Our next speaker will be Dr. Vaishali Phatak. Dr. Phatak will speak on the topic of memory and epilepsy. Dr. Phatak is an assistant professor of neurology at the University of Washington. She specializes in neuropsychological assessments of individuals with known or suspected neurological disorders. Dr. Phatak's research include language function in epilepsy and the utilization of memory strategies for mild cognitive impairment. She earned a Ph.D. in clinical neuropsychology at the University of Wisconsin-Milwaukee. She completed an internship at Long Island Jewish Medical Center and a postdoctoral fellowship at the Mayo Clinic. She is also a board-certified neuropsychologist. Please welcome Dr. Phatak.
Thank you. Nice to be here. So I'm planning to talk about memory and epilepsy. I wanted to talk about the science behind what we know on cognitive functioning, and I'm drawing from studies not just in epilepsy, but in other neurological diseases as well. And towards the end, I want to talk about just some of the practical tips that we could do to improve memory. So kind of the outline, what is memory, what causes memory in epilepsy specifically, and as I said, the talk about practical tips. What we know about memory, a large part comes from an epilepsy patient known as HM. And so epilepsy and memory research has been very closely entwined, and we know at a macroscopic brain level and a microscopic level as well. Now, memory itself is a much larger, complicated process than we realize, and because when memory works well, we don't give it much thought. It's when we have the memory retrieval failures is when we give it thought. Otherwise, you know, it's doing its job. So breaking it down in terms of memory theory, there's actually attention. You have to be paying attention. It has to be thought of as important to be paying attention in the first place. Then it gets encoded into the brain structure, and this needs to be stored and then retrieved at the right time. So these are general 4 steps. And these are somewhat spread out across the brain, and that's why it's kind of grouped into different steps, because different brain regions are recruited for this processes. There actually has been research to look at what they discovered is that there's no grandmother cell. So there's no one brain cell in your brain that stores information about your grandmother. So if you lose that cell, you know, it's gone. So thankfully, we have redundant systems in the brain to help with memory. To break down, I might go through this more quickly because I already talked about this. Attention is, there is so much going on in your environment. Focusing, paying attention to someone speaking right in front of you, and concentrating, shifting gears is an important factor. What we don't realize actually is that our brain continues to monitor the environment even if we think we're only paying attention to one place. This was shown neatly by something called the cocktail party effect, where if you imagine you're talking to someone in front of you, but there are lots of conversations happening in the room around you, what they realized, if somebody said your name way across the room, you have a tendency to shift and notice that that was said, which meant that your brain was actually monitoring other conversations in the first place for you to know, and things like your name kind of draw your attention to those conversations. So your brain is actually vigilant about the environment even more than a person can realize. So this attention phase plays a factor in what we actually decide is important, and then is considered important enough to devote brain space to and encode. So the medial temporal region of the hippocampus is an important brain structure in forming these new memories, assigning more permanent storage and making new memories into the brain networks. The those memories get stored, incorporated with other memories that you have connected, and retrieval is an important factor in pulling out memories. And in fact, a lot of people, when they say, oh, I forget this person's name, or I know what I want to say, but I can't get it out, that's a retrieval failure rather than a primary encoding failure. So, science of memory has actually taught us a lot, not just in terms of where brain functions are involved in memory, but how epilepsy can affect the memory systems as well. So, memory systems can be disrupted during a seizure. Complex partial seizures or generalized seizures cause an alteration in awareness, and the memory system can be affected, particularly seizures arising in that temporal region that I said, hippocampal region that makes new memories, can affect memory. Postictal recovery can cause loss to memories as well, and cognitive recovery after seizures is actually quite variable. It depends on the type of seizure and severity of the seizures as well. But people with seizures actually report memory problems or have memory problems at a greater rate. This is not just during seizure and after seizure, but the periods in between seizures as well. People with epilepsy have higher rates of memory problems. So some of the seizure variables that are associated with the memory problems are the age of seizure onset, seizure frequency, duration of the disease, which is kind of correlated with the age of seizure onset. So earlier seizures can more likely affect thinking process, cognitive processes, and then could have a factor in terms of school. Seizure frequency, higher frequency of seizures, more likely to affect cognitive problems. And the longer somebody suffers from epilepsy, the more likely they are to have cognitive dysfunction. People with epilepsy are more likely to have higher rates of memory problems, but there are other neurological conditions that can occur with epilepsy, for example, head injury or a status episode that can complicate cognitive functioning. Another factor that we know in epilepsy is that there are side effects to anti-epileptic medications, and memory problems or attention and processing speed problems are the most commonly reported with anti-epileptic medications. Now, there's a huge variability. There are certainly certain medications, the more sedating medications that are more commonly associated with cognitive problems, but there's a huge variability in terms of what patients report in experiencing cognitive difficulties. But a general rule of thumb is that taking higher doses or taking multiple anti-epileptic medications is associated with cognitive side effects. Again, not a complete list, but head injury, sleep disturbance, depression, anxiety, learning disabilities, these can be comorbid conditions with epilepsy, and they can independently contribute to memory problems or cognitive problems in general. So it's not just epilepsy itself. So the bottom line is, as I said, memory is a complicated process, but there is normal forgetfulness, then there's epilepsy-related forgetfulness, and then there's the possible other forgetfulness from these other areas as well. So let's talk about more. That was really, really a rapid kind of overview of what we know about memory, but I know people are here to be educated, so let's talk about what we can do about memory problems. One of the first things, memory symptoms in epilepsy is a known phenomenon, and it is important to tell your doctor if you are experiencing memory problems because it can affect your quality of life. It it can be associated with medication side effects, and so that's an important conversation to be having with your doctor. As well as it may be associated with other conditions, even transient ones like depression or stress levels. So it's important to communicate with your doctor about memory problems. It's also important to communicate because there might be something in either an educational school setting or a work setting that accommodations can be made for memory or attention and speed kind of things. So it's important to talk to your doctor about that. So head injury, learning disabilities, often we see an overlap with epilepsy, but we don't want to forget other chronic health conditions that are also known to contribute to memory problems. So there's more recent literature on diabetes, which is a chronic health condition, can cause fluctuations in attention and memory. Depression, actually one of the symptoms of depression to diagnose depression is concentration difficulties, anxiety, pain, high cholesterol, hypertension. So high cholesterol, hypertension is vascular risk factors, and vascular disease can affect optimal cognitive function. So I think today you're getting a lot of lecture that sleep is really, really important. So I'm going to continue that theme and talk a little bit about sleep, exercise, memory aids, and keeping cognitively and socially active. So the tips I have are really practical, and they're not surprising. They're your, run-of-the-mill, eat right, exercise, sleep, and that kind of thing, but there's good science behind doing that that I want to talk about. So sleep is important for memory consolidation. We're being bombarded by information all day long, and memory consolidation occurs during sleep. So what you're aiming for is restful sleep, restorative sleep. You can kind of gauge if, and the 8 hours of sleep is just a guideline. Some people need 9 to 10 hours. Some people need less. How you can gauge restorative sleep is, do you wake up rested? That's what restorative sleep is. Have you gotten enough sleep that you wake up rested? If you're not getting sleep where you're waking up rested, try to do problem-solving, triage the situation, even looking at things like in the environment about temperature, noise, light control. I have lots of people who tell me, they fall asleep watching TV. Not a good idea. Or if they try sleeping, they're having trouble sleeping, then they get up and either watch TV or go on the computer. You don't want that light to wake you up. When you're trying to sleep, you want to create an environment that's dark and quiet that will promote sleep. So if there are sleep problems, kind of go through this list of how can you change the environment to promote that restorative sleep. Because we don't want to look like this. This is non-restorative sleep. And so the science does say the frequency of awakeness correlates with the symptoms of unrefreshing sleep, and then daytime alertness is reduced. And like I said, the first step in memory is attention. So if you're not alert and you're kind of dozing off in the first place, that memory isn't, your brain isn't going to absorb the new information. So falling asleep while watching TV, unfortunately, is not recommended. So you have to make a conscious effort to turn off the TV and then take 10 to 20 minutes to wind down. Now, many people think, how many people think you should pretty much fall asleep within 5 minutes as soon as your head hits the pillow? Oh, I see some few hands. Good. No. If you are falling asleep within a couple minutes of head hitting the pillow, you're sleep deprived. It should actually be taking you 10, 15 minutes to wind down and fall asleep. And that's quite normal. if you're falling asleep that quickly, in fact, a lot more time to get that restorative sleep. And during that 15, 20 minutes, if a person tends to be anxious, this is not the time to do your to-do list during that 15, 20 minutes, because that's not promoting sleep. So if you are the kind of person who does that, actually plan the 30 minutes before you're in bed to cross off your to-do list, and then spend the 15, 20 minutes, having nice dreams about being on the beach or counting sheep, whatever. Actually, counting sheep is not a bad technique because it's boring and it will put you to sleep. So if somebody is suffering from insomnia where they're having difficulty falling asleep on a chronic basis, there are actually therapies. So much like therapy to address depression, there is cognitive therapy, because a person might have gotten into a bad habit about that anxiety-provoking, going through the to-do list before going to sleep. And so cognitive therapy can address that, if it's been a significant problem. And then relaxation therapy, which is the listening to quiet, soothing music to drift off to sleep. Mental imagery or guided imagery is actually hearing a tape where they say you're walking along the beach in nice, relaxing scenarios. I often suggest guided imagery to people where music doesn't cut it, because you're thinking so much mile a minute that you actually need somebody else to talk you through to put you to sleep. Then guided imagery is a good kind of technique for that. And there's lots of tapes and products available on the market for both relaxation tapes and guided imagery kind of things. So we talked about sleep being something you can do for memory. Another thing that's actually helpful is exercise. So exercise is good for your heart. It is also good for your brain. And when it's good for your brain, it's good for your memory, and it's good for your cognitive abilities. So this is a tip on how you can increase exercise into your routine. So how exercise is actually good for your brain is that it improves the tone of your blood vessels, decreases risk of vascular factors, reduces risk of diabetes, depression, and protects brain cells against toxins. So I'm not going to over-lecture on the physical exercise, because everybody knows that's good for you, right? I promised you memory tips, so we're going to talk some about memory tips. Oh, Post-it notes. I have love-hate relationship here with a little sticky notes. Sticky notes have a place and a time, but entire reliance on sticky notes is actually a bad idea as a memory tip. Because not only do you have to remember what to do, you have to keep track of where your note is and how organized your note is. So this is not the best method for memory tips. Best method is to keep it all in one place, and nowadays more and more that's your phone, that's your smartphone, is to keep organized in one place. But if people prefer the old-fashioned method, I actually am working with a research program for people with mild cognitive impairment, which are older people who have either vascular disease or are at increased risk for things like Alzheimer's or Parkinson's disease. And we work with them to use this paper calendar so these are all the components that I think a paper calendar needs. At one view, we want to see where you put your, There. At one view on the left here, sorry about that, we want to see appointments. You want to see a to-do list, and then this is the section most people forget. You actually want a little notes section as well. because most commonly reported memory problems that people have are names of people, or I went to the doctor and he or she told me a whole bunch of things to do. You have to write those down. So it's not just your to-do list and appointments, it's also the actual notes of conversations. And let me backtrack here. In terms of, we talked about why this is important. So at the attention phase, we want to optimize getting it into our brain by paying attention, reducing distractions, doing only one thing at a time, prioritizing on what is important to remember. I remember reading a Sherlock Holmes story where he said he makes a conscious effort to remember the things that are important to his job, and things like the Earth rotating around the sun, that's not important to his job, so he doesn't feel he needs to put that into his brain. So making a conscious effort, because we're so bombarded by information, to prioritize on what is most important to remember is an important technique. In general, our brain, or a rule of thumb that you can use is that at an attention span, you can capture 7 bits of information, plus or minus 2. So a mnemonic device where you're chunking the information together can actually get you to absorb more information in. So that's a sneaky way to get in more information using mnemonic devices, or chunking the information, connecting it to other things that you already know. So building a chain, associating someone's name with a mental imagery, or just repeating. Repetition is the most inefficient way, but it works as well. Just having periodic review of learned information. You can sometimes pull out the word or the name you're stuck on by just reciting the alphabet, or going through trying to imagine what else it was connected with. People find out that, if somebody kind of cues you or gives you a reminder, that can help retrieve. And then creating routines. So having designated spots for keys, phones, remotes, completing tasks in the same order and at the same time. So paying bills or grocery, if it's done at kind of the same times, it reduces the demand on your brain and makes it easier to remember those. I'm also going to talk briefly about a concept called procedural memory, which is habits or muscle memory, which is why routines can be helpful things. But putting medications in a pill box in the same place, and particularly in a visible place, is helpful. I mean, the creativity in terms of what people have told me their medication routine is, which is to take it, turn the bottle around so that you know you've taken it, have one by the bedside, have one in the kitchen. I feel simplifying that routine with just a pill box is probably what I would recommend, rather than being creative. But certainly creating a routine that fits into your life, obviously, is going to keep that habit going. So if it doesn't work for you, we wouldn't expect that habit to continue. So another thing to realize, if you notice that you have memory problems, you have to take that into consideration when scheduling activities. It's not reasonable to demand more it just causes more stress if you're already working with memory problems and then expecting to complete like a long list of 15 things in a day. So pacing yourself, scheduling it, and kind of taking a look at what is realistic in the day is also important. Remembering people's names is probably the most common kind of cognitive concern that people report. So some practical tips, as I said, repetition. So when you learn people's names, repeating the names right away, trying to use it more often to associate with that person. And as I said, take down notes of having met the person and learning their name. Also, give yourself a break. This is kind of actually forgetting people's names is a really common and what we call a normative memory failure. So it is okay to ask the person to tell you their name again, as well as using other techniques like trying to get your family member to ask them what their name is. So we can compensate for memory problems. I talked about memory being new memory coming into the brain through the hippocampus medial temporal lobe. There is another type of memory, procedural memory, that is the same as muscle memory, that uses other brain structures. And if we want to try to recruit all parts of our brain to remember, particularly if you're having memory problems. And I think we underestimate how long it takes us to learn new habits. A simple experiment that they did in terms of learning a new habit actually found 21 days to adjust. So if you are used to coming out of your car and taking a right or walking in a certain way, if you just move the location, for example, if you move a garbage can in your kitchen, going to the new place can take you up to 3 weeks, if not 2 to 3 months, to learn a new habit, to form a new routine. Go ahead and try it out on yourself, experiment with yourself. We do learn habits of brushing teeth that you don't forget that because you do it over and over, and those are procedural memory, or typing, playing the piano. Now, HM, the case that I talked about, actually had good procedural memory, and he was a piano player and had more preserved procedural memory. So we want to exploit all parts of our brain that we still can to improve with the memory. So things that are muscle memory that we might not realize, since more and more people are using electronic devices, tablets, to do reading, I know lots of people have said to me, but they just miss the feeling of holding a book. Now, that's what a procedural memory is. It's a muscle memory of holding a book, holding a magazine, and that's why people miss it when they see, when they read that same thing on a tablet. Because I've been giving these kind of lectures, I know that I have to practice what I preach, so I trained myself to change that muscle memory of holding a book to not needing that feeling and to be using a tablet. And now I've trained myself for longer than 3 months, and it took me longer than 3 weeks to do this. It took me several months. Now I've gotten to a place where, because I can do a search on an electronic, when I'm faced with an actual book and I have to search a word, it frustrates me the other way around, because I've gotten used to the electronic way of doing it. But the reason we recommend using a calendar as a compensatory device is we want to get you into the procedural memory or the muscle memory of, oh, this is what I want to remember, let me write it down. So it should get to be an automatic muscle memory kind of feeling, oh, I want to remember this, I want to write it down. So either with a paper calendar itself, like this, or with a smartphone, to train yourself using the procedural memory of appointments, of to-do lists and notes, to feel that during the day, you know, oh yeah, I want to remember this, I'm going to write it down. And that way it's searchable. So everybody knows how to use a calendar for appointments, but it's important for to-do lists too, and it's important to put down to-do lists, including things that you would remember without it being on the list, such as grocery or whatever it is. because a calendar, to be most effective, if you want to train yourself to have this be a muscle memory, you have to practice it on a daily basis. So you have to practice using a calendar at least 3 times a day. So recommend seeing it in the morning to see what you got going for the day, sometime during the day, and then at the end of the day, marking off all the to-do items. So this can also help with sleep, because you can mark them off before you go to sleep so you don't have to do the mental check of is it done or not. As well as to-do items can be moved forward if you don't get them done because of whatever reason. And I cannot emphasize enough that a calendar should absolutely contain notes. It's not just the appointments and to-do items, but it should absolutely contain notes of what has happened. Not totally against sticky notes. For example, a sticky note right out, at the front door saying, grab your keys or whatever it is. Well-placed sticky note can help for a specific item, but your entire note system should not be a whole bunch of sticky notes in a different place. So I talked about this procedural memory and forming new habits, and that it can take at the very least 21 days, but it can take longer than that as well. And the study that looked at this actually broke down the learning new habits into 3 phases. In the acquisition phase, if one of the habits that we're trying to do is to use a calendar, you have to practice using the calendar at least 3 times a day. And in the acquisition phase, you just have to do it as a artificial rote exercise, saying this is a practice to learn a new habit. So we're going to take this rapid habit, let's say in 21 days. So acquisition phase, say about a week. To learn this new trait. Application phase is kind of actually using the calendar at the grocery store, or using the calendar in your at your doctor's appointment, or to remember medications. So application phase is to actually fit it into your life so that it's a functional tool. And adaptation is that, every calendar is unique because everybody's schedule is unique. So you want a calendar system that will be flexible enough that it will actually work with your life. Because if it's not going to work with your life, it's great to have a large calendar with lots of details, but if it's not something you can carry around, then it's not really going to work with your life. So you really have to so this habit program that we've been running, the research that we've been doing with individuals with mild cognitive impairment, has taught us that it's easy to say these things, and doctors and other teachers and other people have told us, write it down, take notes. But it is a very detailed process, and you do have to look at it as this is a new habit, you're working on it, not unlike something like if you're on a diet, you have to be focused and be following it for a while. So it does take time to have it be a different part of your life. So approach it with kind of that level of rigor and proactivity. Kind of running short on time, so I also want to emphasize that brain health, staying cognitively active is important, and people have heard about, keep active with doing crosswords and things like that, but actually you can remain cognitively active by doing a range of things, reading, volunteer work, hobbies. To remain cognitively engaged and socially engaged, again, is picking activities that fit and make sense in your life. Because what we know about habits is that they continue when we enjoy them. So I went through that really quickly because I wanted to give you a lot of information in a short time, but I'll take questions now.
I have a question about lids.
Mm-hmm.
Do I have mini hoonies in my house?
I'm sorry?
You're going to make a sandwich. The bread is in front of you. The peanut butter is to your left. You take the lid off the peanut butter to put some on your sandwich. You reach for the lid to put it back on, and the lid is gone. I've not moved.
You have
What
elves
happened?
in your house.
What happened to my lid? Did the mini hoonies come and get it? Am I losing my mind?
So that's not an unusual occurrence. Forgetfulness is a normal part of aging, and we do have more episodes of forgetfulness as we get older, but it's a normal part of life, even in your 20s and your 30s.
How can I fix that, please?
So one of the things is to, in the attention phase, so that something like that is,
Guilty.
is that if you notice that there's more clutter on the counter, you're more likely to misplace things. So clearing the clutter, making a more proactive, that this is my time to just make a sandwich and
Thank
not
you.
hear anything else in the room.
Thank you.
So that would be a more taking an overt. Because if you've done a routine activity for a long time, it's easy to do it on autopilot, so just kind of taking yourself off the autopilot.
Thank you, ma'am.
Does the research indicate that the same strategies for keeping memories or for developing these in the elderly work for children with learning disabilities as well, or is that sort of a different thing?
So I think I threw in a huge a stew of things on memory that came from many different areas. Learning disabilities can fall into, verbal or nonverbal, so there might be a more unique and a preferred modality that somebody, a child, might prefer to engage in memory. For example, a child might prefer to have practice with something to actually remember. So there could be a unique situation if there's learning disabilities. But like I said, the causes kind of add up. So a kid with learning disabilities will have the normal forgetfulness. So it's important to keep those good habits as we get older. So
I help run a TBI group, and we were brainstorming around memory. And one of the two things we really talked about was keeping clutter off the counters and making sure that as much as possible so you could stay alert to what you were doing, like making sandwiches. And the other one said, we were talking that you always have a pen with you when you're in the bathroom, because your brain goes so many different places when you're in the bathroom that if you remember something, write it up immediately on the bathroom mirror, because then you can put it on the calendar, because you'll say, I'll write that down later.
yes.
As you're brushing your teeth, you'll say, oh, I'll write that down later. But they found that if we just pick up the pen and write it on the board, because you think of all sorts of bizarre things
Yes.
that you need to do when you're in the bathroom. And someone said, we don't have a pen and piece of paper. It gets soggy. So they said, just get a marker that you write on and then it's easy to wipe off. And the next group we came back, there was like a standing ovation about that suggestion, because people could keep track of things.
Yes.
And that was just a miracle for a lot of the people, that suggestion.
Thank you for sharing that. Yeah, so I can't emphasize enough that your memory system should be more than just appointments and to-do lists. It should be notes, these ideas, great ideas that you're having throughout the day. I don't know whether they're exclusively related to the bathroom, but great ideas that are occurring all the time.
My question is about problems with word retrieval and how that might connect with other memory problems and other cognitive problems. So if you can't remember certain words, is that also going to make it more difficult to remember other things?
So the question is word retrieval, if somebody is having word retrieval, whether it's going to affect memory retrieval as well. So we consider word retrieval or word finding to be language deficit, and I just make that distinction just because it occurs kind of maybe uses different brain circuits, the word retrieval problem than just encoding memory problem. So forming new memories is a problem with encoding, and so whether language and memory problems can occur depends on why they're occurring. So if they're occurring because of the seizures or the medications or other reasons, my answer would be it depends. If it's a condition that's affecting both the language and memory systems, then yes, we would expect word retrieval and memory retrieval to occur. If, on the other hand, it's just a language fluency retrieval, it may not affect forming new memories in terms of a problem. Yes.
One of the things I have found in learning, give an example, you're doing a PowerPoint down there, and if I've never done PowerPoint, I just sit there and look at the computer and I'm just gazing at it. What do I do? But if someone shows me one piece to get me started, then I can kind of start figuring out what goes around it.
Mm-hmm.
And sometimes that's all you need is someone to show you that first piece.
Yep.
And like, I still haven't mastered Facebook, but somebody showed me one or two things, and then I kind of get the concept.
Yes.
And I also consider learning putting a puzzle together. I've often described it that what I have to do. First you get the four corners, then you get the border, then you start with the blue sky, then you do the animals, and by the time the puzzle is done, I'm outside the box asking questions.
Excellent.
So those are some of the things I've noticed.
I love that people are sharing tips that we could try out here, because word retrieval or memory retrieval, I think I can say everybody has experienced it in their lives. It is, to some extent, a normative problem.